All right, the time is 12:21. Welcome back to Eyewitness News. Dr. Mark Simpson with Simpson Dental Associates here to take some of your calls. If you've got a question for the doctor, you can call the number right there on your screen. And I love it when you do this. I love it when you bring these in.
Aren't they fun?
Before and after.
And she was just so tickled. I mean, it might not be a huge change, but basically what we did was lengthen the teeth, and look at how the teeth follow her lip line. In this one, the teeth are kind of flat across, and then they follow the lip line there, which is much more attractive and much more youthful. She was practically in tears when she saw what the final result was. That's fantastic.
Very amazing before and after.
Yes.
Let's talk a little bit about the most important thing that I think people can need to know.
Well, especially in these tough economic times, the most important thing is prevention, because you think about it, you never have to pay to treat disease that you prevented in the first place. Sure. So certainly flossing and brushing are a key to that, but also catching things early. I have people all the time say, well, a little piece of my tooth broke off a couple months ago, but it wasn't bothering me. And I always say to them, you know, catch it right then, and it's going to cost you less to fix it, because by the time you give a couple months, the bacteria have eaten away at the tooth, and now you could even have an abscessed tooth or might not even be savable. The other thing that we're seeing a lot of is people that snore, and what happens is as you lean back and when you're laying down to sleep, your tongue falls back and it can cut off the airway. The extreme example of that is called sleep apnea, and some people, I mean, even die from that. So you think about it, if your spouse or your loved one is snoring at night, that is a sign that they've got an issue and their airway is being cut off. So there are dental appliances that can bring that lower jaw down and forward, which a lot of times that's all that you have to do. The most extreme example of it, people need the CPAP machine. To pump the air in to try to prevent that. But a lot of people have trouble wearing those, so then consequently they don't wear it, and then they're still at risk. So oftentimes, once you have a sleep study done, then the first step is generally a dental appliance. That's the most invasive, or least invasive, I should say, way of treating the problem. And you might ask your doctor, if they suggest CPAP, say, well, is it possible that I might be able to use a dental appliance first? Generally, they don't provide those, so they may not suggest that right off the bat. But if you're waking yourself up at night, or you're waking up in the morning and you haven't felt like you've rested well, it's very often the problem that you're cutting off your airway, and then it wakes you up during the night and you're not getting a good full night's sleep. Sure.
Dr. Simpson, taking your calls to the number on your screen. Let's talk a little bit more about that. A lot of people have the CPAP machine. These procedures, though, how often would you say that you do procedures like this for sleep apnea?
It's very, very common and becoming more and more common because people are realizing that it is affecting their health. You're at more risk of having heart disease or respiratory disease, especially heart disease, or even high blood pressure can oftentimes be related to these events where you're not breathing properly and your oxygen's being cut off at night. The other thing that we were going to talk about, the videos didn't make it through, but is how crowns are made nowadays. Now, you want to talk to your dentist about that because, well, we'll interrupt for this for Darlene, who has a call for us. Darlene, what's your call?
I'm calling about my daughter, Janet Brown. She's had diabetes for about 20-some years, and her teeth are all bad. They're broken, and she's going to have all of those removed. And she's a spina bifida, and she has asthma, too. And I was wondering...
I didn't get to hear the end of her question there.
Yeah, I think we're cut off there.
You know, people that have diabetes are much more likely to have dental infection. People that have dental infection are much more likely to develop diabetes. So what I would suggest is that get the bad teeth out of there, very important. And also, if there's any further questions that didn't get in today, you can call our office at 304-342-6162. We'll be happy to answer those questions or look at a particular situation that you might have.
And of course, your website also listed there as well. Dr. Simpson, thanks for coming in today.
Sure appreciate it.
We'll be right back with a check of your top stories and the forecast. That's next.